notable alumni of our university. In the upper right-hand corner is Jose Hernandez, who was the first Latino astronaut. And he was sort of a role model of mine during my time as a student. And it was an honor to later serve on committees with him. I also do work in the area in Stockton, community organizing work. This was a ballot measure that we passed to help the community with library funding. And apart from practicing in private practice, I also do over-the-shoulder implant training with dentists, lessons in 3D printing. And with my understanding of angiogenesis, I see how we can, when appropriate, include PRF or other biologicals into treatment. Today, we're here to talk about dentistry. And to me, the story of dentistry and oral surgery it's largely the same. This skull, which goes back to ancient Egypt, it tells very much the same story that we have for our patients. As you see here, the clinician diagnosed a disease or affliction this patient had and used the best technology of the time to heal their patient or aid their patient. And our ability to help our patients historically has had a great impact on the quality of life of our patients. So if you've ever wondered why you've never seen a picture of George Washington on a dollar bill smile, it's because he had dentures that were made of brass, wood, and were largely uncomfortable. So it's amazing that as presidents of the past could not have a good quality of life because of dental issues, ordinary people today can. And it's amazing the difference that we have as surgeons, dentists, and those in this field to make a difference in the lives of our patients. This was a patient of mine who had cellulitis on the lower left and paresthesia. And after helping her with her treatment, her infection was communicating right into the IA canal. A year later, she sent me a text message that she decided to go into dentistry. And it's amazing that often infections that could truly harm individuals, if not lead to mortality, the ordinary dentist has the ability to diagnose and help patients and make a big difference. So I argue, if George Washington were alive today, our dollar bills would look quite different. They'd look like this. However, the story about, what concerns me, even though we have the ability to help patients today, there are economic trends that are concerning and are actually even more concerning in this time of COVID-19. This figure right here shows the cost of dental services for patients versus the normal rate of inflation. And as you can see that the cost of the price index for dental services is double that of inflation. And that's concerning. In the United States, the number of working adults accessing a single dental visit has dropped in between these 2 years from 41 to 35%. That's a working age adult, someone who in the US, we would expect to have an insurance and be able to access dental services. However, we see here just an annual dental visit. That does not include treatment. That number has dropped and is continuing to drop. The number of individuals purchasing dental services in the US, it belongs to the highest income bracket, which makes sense as dentistry, a lot of it is private pay. And because of that, what we see is that dental care is the number one healthcare service people believe they need, but decide not to obtain because cost is a barrier. And compounded on that, in the time of the COVID crisis, dentists, because of our unique risk to the SARS-CoV-2 virus, we are one of the hardest hit professions, seeing a significant drop in incomes, with offices having to close their doors at this time and furlough or lay off our employees. So, as we look to the future, I believe the dentistry of tomorrow and the surgeries of tomorrow that we perform and the rehabilitations, how we do that is going to look quite different. So I always argue there've always been pressures on our profession to meet the demands of the present. And it's important to look forward with an optimistic attitude. I like this quote of Charles H. Duell. He was the head of the US Patent Office in 1899. He said, "Everything that has been invented, that can be invented, has been invented." And just a few years later, Thomas Edison invented the light bulb. What's amazing is we have amazing tools today, amazing tools and instruments that can help people. And I believe one of them is 3D printing. So let's discover 3D printing together. What is 3D printing? In my mind, it's the ability to create something from nothing. It's the ability to pay as much interest into the internal geometry as an object as we pay to the external geometry. And quite frankly, it's beautiful. How is 3D printing different than other forms of manufacturing? Well, there's multiple forms of manufacturing, but as dentists and we know how to carve, we're quite familiar with subtractive manufacturing, milling. But additive manufacturing is the ability to create something layer by layer. And it's not a unique concept for dentists. The average dentist is actually quite familiar with 3D printing, whether they know it or not. Forming a composite layer by layer is, in fact, 3D printing. So that's why I also believe that for dentists, after the tools are developed to generate a true understanding, is not difficult at all. What's amazing about 3D printing is that there's a few objects that you can only 3D print. This is called a planetary gear. It's just amazing to see what can be 3D printed. From musical instruments to Belgium chocolate to homes. It's amazing these shapes and creations that can be made. My introduction to 3D printing came with an organization called 3D Heals. As a student in San Francisco, I would often run around my dental faculty and ask if anyone is 3D printing and how I can get involved. This was starting in 2012. And people said, yeah, it'll come at some point, we'll be 3D printing. But I said, why aren't we 3D printing? We're in San Francisco. So when I didn't find initial answers inside the halls of our institution, I looked outside. I went to hacker spaces in the Mission District. I just went to meetups in the area. And eventually a colleague led me to a group called 3D Heals, which was a small group at the time of physicians and researchers getting together just to discuss 3D printing. With 3D Heals, I got to know a lot of individuals, orthopedic surgeons, radiologists, individuals in the FDA. It was truly an eclectic experience being able to interface and interact with individuals across the spectrum. On the upper left is Jenny Chen, the visionary behind 3D printing, and she dreams of a world where medicine is personalized and it's decentralized so we can get care to people when they need it. 3D Heals, which started off as a San Francisco-based community, now has chapter communities in many places around the globe, and it's continuing to grow. It's quite exciting to see when we can pool ideas and talent together, the thoughts that come across. At one of our conferences, a university that came and sent different individuals realized they had 4 labs working on the exact same product. So a direct benefit of our conference is they were able to centralize or decrease the duplicity within their institution. I would urge you all, our good friend Rui here will be a speaker at our next conference, which is 3D Heals 2020 in July. It was going to be an in-person global conference as we've done it over the years in San Francisco. Now it will be a virtual conference, and we're excited that we hope that we can reach more people and bring together a closer community. Let's talk about medical 3D printing. And I think that by understanding medical 3D printing, we can often understand the direction we can take oral surgery and dental 3D printing and learn lessons back and forth. 3D printing is really changing the world of prosthetics, giving individuals truly personalized prostheses that impact the quality of their life and can even turn into art pieces that represents them as people. I'm going to play a short video.
I came across Derby a little over 3 months ago now, I think. I had adopted a dog through this rescue group called Peace and Paws. He was born with deformed front legs. And I kept looking at his photo and hearing his story, and I cried literally every time. Finally, I messaged her and I was like, okay, I'll do it. Foster, I'll take care of him. I had to try and help this dog. We decided to get him a cart, which worked quite well, but they limit his mobility in terms of being able to play with other dogs, and it's not really the full motion of running.
For this project, we're using a variety of 3D technologies, and that allows us to get in there and really modify the organic digital models quickly and easily and start to do the sort of designs that Derek wants us to do.
The great thing about using 3D technology in Derby's case is having these images on file on a computer and being able to print them is a lot quicker than having to hand sculpt every single mold and rebuild these braces 5-10 times.
With prosthetics in general, a lot of the designs are going to this running man sort of look. And I was concerned with doing a running man that he would end up digging them into the dirt. And so that's really where I came up with the loop idea.
Hey, Derb, you got your new legs.
We started them off very low, and so that it wouldn't be too drastic. We have a line called the Project 5500, which enables us to run dual materials. That has really been key with designing his prosthetics.
I got it. I don't become impressed very quickly. But when I saw him sprinting like that, it was amazing. It just, I couldn't believe it.
The first time he was put on them and he took off running, he was just so happy. I was absolutely amazed at how well he did.
He runs with Sherry and myself every day, at least 2 to 3 miles. He runs faster than both of us. He never really tires out. He's just so happy to do that.
This is what 3D printing is all about. To be able to help anybody, dog, person, whoever, to have a better life is just, there's no better thing to be involved in.
You know, and we find ourselves in that position every day with patients, where we're trying to find personalized, bespoke solutions, patient by patient. Very much like the Darby who didn't have legs, or this tortoise whose shell was burned in a fire, and they were able to scan another tortoise, design and piece together a shell and later paint it to give this tortoise back its appearance. It's amazing these solutions that can be devised. 3D printing with medications. This is a frontier that's being crossed to say, well, if we're able to truly 3D print unique shapes, well, what does that mean when it reaches the pharmaceutical industry? And we can print in different shapes, in different release profiles. There's a company called FabRx, and they utilize various types of 3D printing, from selective laser sintering that uses a laser on a powder to form a shape, to semi-solid extrusion, which is basically like almost like cake frosting, or stereolithography, a resin that meets a laser or a light source, to create different types of medications based off the patient, whether they're an elderly geriatric patient, a pediatric patient, and to be able to create unique medications or patient-specific implants. This is an area of interest, I know, to the group. There's a company, Anatomics, based in Australia. And for a lot of orthopedic surgeries, often the number of sterile items that have to go into the OR or be prepped before operating is massive. And the preparation for cases often leads to an increase, is one reason why these cases are so expensive. The CEO of Anatomics and orthopedic surgeons themselves, he now walks into the OR with a briefcase that has everything he needs to perform his surgery. Or vascular 3D printing, which is an area that then comes into to looking at organ development. Being able to print the lumen in the endothelial cells is a barrier that's looking to be crossed. Let's look at dental 3D printing at this time, and oral surgery 3D printing. The initial need for 3D printing came when looking to see how do we make dental implant placement more accurate and precise. Dental implants are one of those areas where individuals approach them from different experiences, skill sets, and trainings, and it can often lead into either positions that are difficult to restore, non-restorable, or straight out harmful to the patient down the road. And unfortunately, there have been a number of cases of these poorly placed implants, from this case to a case where an operator just, probably thought that they were adding more implants as an insurance package, or, a lab receiving an impression for a master cast and wondering, what type of prosthesis should I make? That, of course, these are extreme examples, but surgical guides help the beginning clinician place implants more effectively, and the trained clinician just place implants essentially more efficiently. So the ability to pre-plan a surgery and then execute it leads to much better outcomes for patients. I'm going to show you the work of one of our colleagues, Dr. Naheed Mohammed, who's taken the concept of surgical guides a step further and makes sort of customized surgical guides based off his surgery. So here's an example of his Ramist harvesting guide, where he pre-plans the exact block that he wishes to take out of the ramus and avoid structures such as the mental foramen. Another example of his Ramist harvesting guide. Or a root tip access guide. I think this guide is rather ingenious, where the root tip is in place, so he decided to create a window to access his root tip, and then a pilot guide for his osteotomy. Or, lateral sinus window guides, where we can pre-identify where where an artery may be within the lateral wall of the sinus, and create a guide that can help us maneuver around the artery to prevent complications. Or a symphysis harvesting guide. So, of course, many clinicians in the room may be saying, well, I don't need a guide for these procedures. But as training wheels to make someone more effective or to make you yourselves more efficient, guiding these procedures will or may have benefit. Or just pre-planning a surgery from a model, pre-planning your membrane designs, so you're spending less time after we've opened the patient. Or guides for endodontic applications, where if there's a calcified canal and to navigate one's way into a canal or to the root tip, endodontic applications of surgical guides are increasing, and there's more software available for these developments. Or whether we're looking to use 3D printing to create guides to stabilize transplanted teeth in this case, or pre-plan and execute a root canal so we can avoid communications with the IA or even just within the canals themselves. Guided apicos, or in cases of severe atrophy, or where implants have been placed, or implants that have now led to bone loss, and the regeneration in these types of cases would be too difficult. We have the work of our good friend Rui here. The idea of being able to create personalized structures either for regeneration or personalized structures where endosteal implants alone, zygomatic implants alone, are not enough for the patient, or the patient would be better off with a better solution. These personalized implants pose a great help in the future, both being able to simplify, de-risk what would be generally a very extensive surgery for someone, and streamline a prosthetic process. It's truly amazing the work that I see being done at Bone Easy, and the potential benefit of this work for many, many people. I see that our good friend Cesar Vieira is in the room. It was truly a wonderful time last year having the opportunity to visit you all in Portugal and spend time with you. I look to those memories fondly, especially in this time of self-isolation in California. I wish I could be with you sharing a hug or a meal. Let's look at prostheses. This case, there's a lot of interest at this time with digital prostheses and CAD/CAM designing of dentures. Being able to mill dentures and 3D print dentures is not a new concept, but I think the software to power it is getting better. However, this is no ordinary denture setup. This case was done by one of our colleagues, Corey Glenn, who I got to spend some time with him on his farm in Tennessee. His assistant on the lower left was getting a lot of compliments for her teeth whenever patients would come in and see her. So they decided to scan her teeth and put her teeth on a denture. So now in her town, there's lots of little old ladies walking around with her set of teeth, very much like the tortoise who got burnt and had a shell made from another tortoise. Or being able to CAD/CAM design, 3D print, or even later mill full arch prostheses. And the accuracy of these CAD/CAM restorations, there have been a decent number of cases where the number of occlusal adjustments or refining at the end is almost minimal. And that gives a lot of hope when it comes to these complex rehabilitations, that if we're able to remove these minor sources of error at each step, we're able to create these prostheses in a much more streamlined way for patients to end up with better better outcomes. So here is an example of a 3D printed temporary prostheses. And then the question goes, well, okay, if it's a temporary prostheses, it's not the permanent restoration. Well, yes, it's not the permanent restoration, but how long would you expect a temporary prosthesis to last? Does this actually mean that we can, if we can 3D print these prostheses and relatively significantly more affordable than milling and glazing a zirconia or other restoration, well, if this individual, why don't we 3D print them a new prostheses every 2 to 3 years? How long does a prosthesis need to last for? Do we need to make them, a $10,000 prosthesis, or can we make them a $1,000 prosthesis? What does this mean for the future of rehabilitations? Or when we combine our surgical guides and our prostheses ready to go, so we're set to guide our implants into the correct spots, and this is truly prosthetic surgery. And then we have our conversion prostheses ready to go at the time of the surgery. Or oromaxillofacial prostheses. I often think about, the number of patients in my time I've had to make obturators for. And if someone has, a large device for an oromaxillofacial prostheses, this was a case I saw once where, they claimed the print time was 47 minutes. I had this experience when I was a student. I made a denture for an individual, and it took us, based on our school's gold standard protocol, a good 4 months to finish this denture making process. And the state insurance only covers a denture every 5 years. A month after I finished his denture, he got into a scuffle on the street and he was hit and his denture broke. And he came to our dental school in tears saying, my denture is broken and I can only get another denture in 5 years. What can I do? If we have the ability to 3D print prostheses, the cost of a second file printed is rather minimal. There's truly or if your patient that you make a prosthesis for moves across the country, moves to another town, a city, it makes it much easier for individuals to pick up our work and follow up and help the patient in their path. We're seeing the development of 3D printing for fixed prostheses, tooth-borne prostheses, 3D printed guides for crown preparations, for bridge preparations. In this concept, there's a company called First Fit, and what their workflow, you send basically an optical scan, an STL scan to them. They will design you a guide and a crown. So when the patient comes back, you prep the tooth and you cement the crown or the bridge or the veneer at the same time. An interesting workflow, not one I've tried myself, but I'm rather curious to see how the accuracy and precision of this device. So, what can be 3D printed? Lots of things can be 3D printed that we haven't talked about. In the field of orthodontics, whether we're printing the aligners, night guards, or printing indirect bonding trays, printing partials, temporaries, night guards, I think that we have a true opportunity with 3D printing to for dentists and surgeons to truly take control of the creative process of their wish, or at a minimum, look at the lab bills that we incur. And if we can decrease the lab bills and the time it takes to develop solutions for patients, there's a lot more that we can do for our patients. Or in the field of biologics, Dr. Rui, and looking at bone scaffolds with hydroxyapatite, I think is amazing. Or the PEEK membranes that he showed me. Or when we look at pulpal regeneration, a chunk of my research during my undergrad days focused on tissue regeneration of the pulp. The ability to either 3D print, a microdrill directly, or 3D print the mold of canals and engineer pulps in the future. I still think that it's, as endodontics is practiced in 2020, that the fact that we're still basically devitalizing teeth in this time and age when we could push forward to keep teeth vital even after infections, I think that this should be an area of study, and this is where we need to be focusing effort. So let's take a step back into the past. I'd like us to talk briefly about the year 1980, and not just because it was in 1980 Pac-Man was invented, but I think 1980 is a vital year for all of those in the field of dentistry and oral surgery. That was the year that Dr. Mormon at the University of Zurich thought of the idea of, can someone basically scan a tooth and create a filling in a grinding machine? And that truly gave birth to CAD/CAM in our field today, and the development of CEREC, the ability to scan, tooth preparations and design crowns and bridges. However, what's interesting about CEREC is the cost to, the entry cost to get into, of course, it was a new and novel technology, but, within the first 30 years of CEREC coming out, I believe it was between Germany and the US, they had less than 15% of market adaptation, just because the entry fee of these scanners and machines, and having it being a closed system, it was too high for the majority of offices. So while we thank them for introducing, I thank them for introducing the concept of CAD/CAM into our fields, I think that the barriers of even further adaptation have been high cost and closed systems. And that's something that we need to work to lower costs and open systems. And then the next year was, another milestone was in 1997 when Invisalign launched and came up with the idea of using, basically taking scans of teeth or molds of teeth and computer modeling the shifting of teeth, and then vacuum forming aligners. Our university in San Francisco was the first research site for Invisalign, where Invisalign was first, where the protocols were tested and refined with direct patient care. And Invisalign has had numerous success in truly being the first mass market 3D printing solution in dentistry. They've done very well. However, I think what's interesting is even a company with such a market share today, they can't rest on their laurels. This is words from a design student, Amos Dudley, who said, what is to stop anyone from access to a 3D printer from making orthodontic aligners? And this was 2 or 3 years ago, he said this. And he, as a college student, took alginates of himself, modeled out his tooth movement, and moved his own teeth. And I think that just goes to show that at this time, the skills and the resources needed to create these solutions for patients, or even for ourselves, are truly being democratized. So it's an interesting world, and it's optimistic, because the lesson that I pull away from this is we can all 3D print. It doesn't take too much to get into this field. So this is me. This was the week I graduated dental school. I saved up and I bought my first 3D printer. And I was so excited, I printed an Eiffel Tower, which is now closed due to the coronavirus. And it's been fun tinkering with 3D printing, as myself as a clinician in my office. Here was a patient of mine who presented for a full mouth rehabilitation. And this was before I had an optical scanner, and she said, I can you please fix my upper teeth and then we work on my lower teeth. And in a traditional case, even though she had the root tips, the severe perio, there were no infections in her jaw. She just came in very low self-esteem, and she needed a boost of morale. She just needed to look at herself different in the mirror. And traditionally, I would have said, no, I first need to remove those lower teeth, because if I take a mold in your mouth, your teeth are coming out. But I said, let me just try something new. So what I did was I just took her scan of her lower jaw and segmented out her teeth. From there, after segmenting out her teeth and just cleaning it up, I took that to our 3D printer, printed it, and I was able to articulate her lower bite without even putting a scanner in her mouth. What was interesting, when we delivered her final prosthesis, I didn't have to make a single occlusal adjustment. And it really surprised me, because I thought that I was, by not taking an optical scan at this time, or a PVS or alginate impression, I was actually going to end up with more adjustments at the end, but not a single occlusal adjustment in delivering her immediate denture. Or a case where a patient presented to me from an orthodontist, and the orthodontist asked if I could expose and bond impacted premolars. And I did this one just more as a thought exercise to see if I could be more efficient at exposing and bonding some impacted teeth. And I did this more as just a demonstration case, just to see. But from there, this patient had some impacted premolars. So starting off with a CBCT and then an optical scan, I basically identified where I would want to place my the orthodontic chain, and printed that as a guide. And this was just a really fun case. The orthodontist came, I had lunch with the orthodontics a number of weeks later, and she said, the patient was very pleased. The mom was very impressed with the attention to detail, and those chains, I put a lot of force on them and they have not come off. So, I'm in the process, as I would consider myself a tinkering clinician at this time, and with dreams to figure out what solutions can we create for patients to help patients in their life journey. And so it's I consider myself more of a student than a master, and so I'm just here to learn with you all. The process to creating 3D printed solutions, as many of you know, is scanning, designing, and printing. We start with STLs or OBJs, and so in these manifolds, I just find them beautiful to see how computers model them, and the more of these tessellating patterns we have, the more detail we have, and it's amazing that that having these manifold meshes and whatnot. It's just right in line with the work we do. So can we apply all this dentistry? I say we can. There's so many more optical scanners available today than in 1980, and the prices have just dropped. It's that we can get scanners anywhere from even now, around $10,000 to however much you want to pay for it. And the difference between the scans are almost, there will be some differences, but they're almost negligible to get an accurate scan. Or we can get STLs from our CBCTs. And as these systems open, it just allows us to get more and more data. Design-wise, I do a lot of work in Blue Sky Bio as a, as someone with what I would say a relatively new practice. A big barrier to jumping into this field early on, even as a student, was the lack of availability to low cost or pay-per-use software. But I'm glad that Blue Sky Bio has really done more with that, or Mesh Mixer. I like to follow the work of Gustavo in Argentina. The things that he's able to do in Mesh Mixer just truly mesmerize me. That as we use these engineering softwares that are free, that can basically design anything, and we understand how they can be used for our purposes, it's going to be more and more empowering. Or Blender, which is also an engineering software that allows us to, I think, in maybe add on modules much easier for specific design purposes. So now there is the emergence of companies, a number being d3tool.com, Blender for Dental, that creates modules you can buy and plug into Blender, and that facilitates the designing process for whoever's using it. I think it's very empowering to see this. Or more proprietary softwares, ExoCAD, which more recently just got bought out by Invisalign's company Align, an interesting move in the market. That's more of a proprietary software that if, I would assume, depending on your case volume, that some of these more proprietary softwares are very powerful and can do a lot for us. I thought Zircozon released a piece of software interesting, and as I've been trying to learn these softwares and develop my understanding in CAD, you always feel like, as Roy and I were talking earlier, you feel like you just want to be able to reach into the screen and designing it, because clicking a button here or dragging something there doesn't often give us the result we want. So I look forward to a world where our design tools can just be much more intuitive, and we can design how we normally work. Because at this time, I feel you both have to be part computer scientist and part, clinician in order to get what you want. And print. So there's many different types of 3D printers out there. As far as methodologies of 3D printing, we saw in the Fab RX slide, semi-solid extrusion, FDM, SLA, DLP, SLS, selective laser sintering. There's many different types of 3D printing. For the common use, say if you're not printing medical devices, for the common use, say a desktop printer in offices, there's a number of great printers, and the cost of these printers have really come down, which is exciting. From the Photon printers, Formlabs, the Moonray, which I personally use in my office, it's truly exciting. And or if you're a lab or a higher volume clinic, printers that print that print much quicker, that are truly amazing, the NextDent printer or the Asiga. Before the NextDent printer came out, Rick Jacobs, who is the mastermind behind NextDent and this printer, he was one of our speakers at the 3D Heals Global 2018 conference. And now just the availability of dental resins from from denture bases to surgical guides to trays, it's really exciting. I think at one point we didn't have the 3D printers that could print what we want. And then at some point we didn't have all of the materials to print what we want. And now we have the printers, we have the materials, we have more softwares, and that's where, and that's where things are really going to be opening up. Or if you, if you don't want to purchase the 3D printer at this time, but you just want to test your design skills and print things from time to time, a great website I recommend individuals to check out or just play around on is Shapeaways, where you can either print things that have been already designed, or you can, you can choose to have something you made printed in a metal, in gold, in a plastic. I think it's amazing to have access to these 3D printers and then have it delivered to you. For a lot of these reasons that we discussed, that in Smart Tech, in 22 years ago, published a market forecast. And they estimated about this year that the 3D printed market within dentistry alone would be worth about 3.1 billion, and that would set to triple in the next 7 years. And as we see the convergence of the types of printers that are out there, the materials, the development in software, and just the interest and the energy that are coming from clinicians at this time, I think that that this report is probably right on track, or if not an underestimate. We'll move a little bit into 3D virtual reality. And my interest in virtual reality initially came, this was a couple years ago. I just recorded myself in Tilt Brush. I was just so frustrated trying to learn some of these CAD/CAM softwares that I said there has to be a better way to do it. And as clinicians, we're taught to cut, we're taught to carve, we're taught to shape in real life. So why don't we apply those skills in a virtual space and design our files in a virtual space? Plan Mecca is sort of a company at this time taking this lead, pushing their creating modules for surgical guide planning in 3D. Because why not? It just makes sense. So if we could bring these DICOMs, these STLs in virtual reality, well, why can't we shape them or have virtual labs? And that is, it's undoubtedly that is going to be on the horizon. Or for clinical training, in order to pass on our skill sets, whether it's in operative dentistry or in surgery, as clinicians, we're haptic. We learn by feel, and all of that can be built into a virtual environment where you can get real-time haptic feedback. So you can train people as a surgeon as far as what should the bone density feel like in this case to ensure stability. Palpating lesions, drilling out caries, whatnot. If we can quantify these and pull in data on these sensations, so we can pass on our skill. Or in the area of practice experience, even taking out a single tooth is a rather invasive experience for a patient. Yet alone taking out impacted teeth, or, reducing a jaw, or, rehabilitating someone after a trauma. Using medications we have at this time, but also virtual reality, we know that pain is not just physical, it's emotional. Well, why don't we deal with that side? Or it's experiential and put someone who's in our offices, in our outpatient surgery centers, don't keep them in an outpatient surgery center. Let's put them on a beach. Of course, this design for, using these headsets are rather big, and this dentist is struggling to work around them, but this technology will improve. Or why don't we use virtual reality to enhance ourselves? Virtual reality AR. What does the clinician of the future look like? What data will we have on our fingertips as we move and as we move into the future. Of course, this is this would probably scare you and me and the patient, but I think that these technologies will get more elegant with time and become part of our lives. Or in the field of education, and this has been of specific interest to me. I've worked with a group at the University of the Pacific called a CUBE, which is a Tinker hackerspace. And they've developed a number of virtual reality educational experiences. So this is the head of the group talking, and we started a project where we said, it's really important. We want to test out education and virtual reality. So let's record the informed consent process in virtual reality, because we know when patients are in virtual reality, they pay much more attention. And we can actually gamify the process, so we know when we have consented someone in virtual reality, they actually know the risks of the procedure. This room that you filmed in is actually the museum of our dental practice, which is about, our practice is about 96 years old. And even though we've updated, we decided to keep one room and turn it into a museum. Out of interest, we did our initial shooting there. So this is the team at the university, and we've, unfortunately due to COVID, we can't meet at this time and finish the project, but we will at some point in the future. So when we are looking at 3D printing today, I hope that we'll leave with a greater sense of optimism that I don't think that 3D printing is merely just an incremental increase, an incremental advancement in technology. I think we have something new. I think we have, we don't just have a better phone, we have a smartphone compared to what we had before. And I hope that it'll help individuals in first world countries, but then it'll also help individuals in third world countries who don't have the infrastructure that we have jump the infrastructure barrier. Whether we're helping individuals with prostheses, in other places around the world where it's difficult to get them resources, or we're helping vulnerable populations in the US. The Department of Corrections in Texas, many inmates didn't have dentures because the prison system said they couldn't afford to. But with 3D printed dentures, they were actually able to give dentures to their inmates and make it affordable. Or in Afghanistan, where there's absolutely no infrastructure. And I had the opportunity to spend a little time with Dr. James Rolfe, the director of the Afghan Dental Relief Project, who told me at one point there was one dentist for every 500,000 people in Afghanistan. What future do these children have? And can we use 3D printing in the future to cut the barriers to actually help them set up a new dental infrastructure? So, whenever we look at 3D printing and a new technology, I always think of the quote of Henry Ford, who asked people, who said, if I would have asked people what they would have wanted, they would have said faster horses. And he gave them a car. So I think it's important to look into ourselves as clinicians and ask ourselves, what do we want for our patients? What do we want for our communities? And let's design the future. So this is my contact information. I got married 3 months ago, and now I'm in isolation with my wife. It's a lovely honeymoon. You're always welcome to reach out to me, but there's one thing I do want to invite you all to. It's a webinar that we'll be having this coming Saturday with 3D Heals and a group of members from our community looking at 3D printing in the time of COVID-19. There's a lot of buzz and interest on 3D printing PPE, and we're bringing a number of people in the room under a ask me anything format, so we can learn as a community what are our opportunities, limitations, obstacles, and challenges to using 3D printing for good at this time. So I would just like to thank you all for your attention and bearing with me. I truly appreciate the opportunity to speak with you all today.
Okay, thank you. Very nice. I have here at least one big fan of Blender, and you were talking about the platforms for designing. You also told me there is a new tool that you didn't mention here. It's a friend of you. It has a site called 3D D3 Tool, no?
Yes,
.com.
let me find it for you. Would you like me to share the website?
Yeah,
Or
it will be nice. Because we have some people who loves to design and people that has the same passion that I have from Blender. Stefan
wonderful,
Berger, for example, which is an attendee, which also designs medical devices with Blender. And
wonderful. So
you
I
see,
just posted
is
group
okay.
chat. This our colleague Kevin Yoder from the state of Washington.
Can
You
you
know, and
share your screen
sure,
again and show us the website, probably?
I asked you to keep, Kevin, who developed this, in your good thoughts. His wife is pregnant at this time, and the state of Washington said if you treat a non-essential patient, they will actually prosecute you.
No, okay.
Let's see here. Let me share my screen. So this D3 Tool is the website. Can you see my screen, Roy?
Yes, yes.
Wonderful. So he developed a module that will go into Blender.
It's an add-on.
It's an add-on into Blender to design a custom mask.
Okay.
And him and his team develop many add-ons for Blender and Mesh Mixer.
Okay. Nice. So you can design splints, or you can test for a dynamic movement of occlusion, no?
Yes. So let's see here. I know that they have an articulator. They have lots of different pieces. Yes.
Okay. Thank
Yes.
you.
A profile
Because
generator.
no, you say. What I was saying, it's incredible the amount of communities that are growing around these free softwares that in nowadays any one of us can do these things. No, we can starting our own workflow on 3D, on digital printing and digital CAD cams and everything else. So it's really up to us to do our job. There is a question here. Which software do you think it's best for designing guides?
I've been using I think it's one of those things where I think it's whatever you're trained on. Personally, I switch between Blue Sky Bio and Mesh Mixer.
Okay.
I think that it's relatively easy to work between the two, and it doesn't take too long to learn that process. There's a lot of videos right now on YouTube, and if you need help, feel free to reach out to me. I'd like to learn with you.
Okay, thank you. And I think it's all. Very nice presentation. We are all delighted for seeing you. I wish you all, and you also, keep safe, okay? And
Yes.
we'll keep in touch, okay?
Wonderful. Thank you so much. It was a
Okay,
pleasure.
thank you, everyone. And see you tomorrow on the next webinar, okay? Thank you. Bye.
Bye.